Thank you, Mr. Speaker. We spent the afternoon in the House yesterday debating the need for an emergency response to the fentanyl crisis. In order to get to that point, every member of this House agreed to have that debate, recognizing that there's a crisis. And yet the government has failed to respond by calling a public health emergency to coordinate resources to save lives. And since the minister and the government won't call an emergency debate, my question is, where is the support for the true emergency worker, emergency medical services? How much money has been allotted to them during this crisis, and how much additional resources?
Associate Minister of Health.
Thank you, Mr. Speaker, and to the member for the question. We are incredibly grateful for the work that first responders, including firefighters, paramedics, police and peace officers, are taking in responding to this crisis. And we've been working very diligently to ensure that they have the mental health supports that they need to help process any of the trauma related to the work that they do day in and day out. I'm regularly meeting with members of emergency responders representations from across the province to make sure that we have those that supports in place. And one of the key things that we heard was the desire to be able to.
Minister. First supplemental.
Given that addiction and mental health issues are extremely complex, and it's certainly a tragedy for those that are suffering from addiction and mental health problems, but it is equally tormenting for the families that love them. To the same minister, you've outlined some help for addicts. Can you tell Albertans where are the supports for families of those suffering from those problems? Because they're also hurting. Can you tell me if you're supporting them?
Honourable Minister.
Thank you, Mr. Speaker, and to the member for the question. One of the first things that our government did when we came into office was to create the Valuing Mental Health Commission to review some of the work that government had been doing on mental health supports and to make sure that we had a more coordinated system. What we found, a very fragmented system without supports for families. Our government, since the adoption of that report, has been working diligently to make sure that we have supports across the province so that it doesn't matter which part of Alberta you live in, that if you need mental health support, that help will be available for you.
Thank you. Given that during the emergency debate we heard multiple stories about the tragedy of addiction in families, and I referenced one such family during my speech, and most members of this House recognize that their families, and all families, are at risk. To the same minister, families are calling this government to action. Can you outline what steps are being taken with our youth to educate them and their parents to prevent the issues that our province is currently facing?
Associate Minister of Health.
Thank you, Mr. Speaker, and to the member for the very important question. Our government has been working very closely with cross-ministerial to make sure that we've got supports available in schools and we have that education piece available, in addition to some of the public advertising that we've been doing around the concerns around dangers of fentanyl, as well as the take-home naloxone program. I am always very eager to meet with other members of this House and with members of our community about ideas of things that we can be doing that will help to improve the supports available, as well as the services.
Thank you, Honourable